Okay, well, there's a change in strategy at the White House on health care. After weeks of letting members of Congress try and work out a health care overhaul on their own, President Obama will spell out his own plan to a joint session of Congress next Wednesday night. And Bloomberg's Peter Cook joins us now from Washington with some reaction to the president's new approach. Peter.
A new strategy indeed, Betty. I'm here with Dr. Marc McClellan, one of the nation's real experts on health care. He ran Medicare and Medicaid and the Food and Drug Administration under President Bush. He's now the director of the Engelberg Center for Healthcare Reform at Brookings Institution, and he is a Bloomberg contributor as well. Dr. McClellan, welcome back. Appreciate you joining us. And what do you make of this change of strategy at the White House? Is this a mistake for the president to get his hands dirty and get into the details here, or is this a step forward?
If the president wants reform, and he clearly does, this is an important step to take right now. He's got two audiences with this address to the joint session of Congress. One, and probably the most important, urgently, is the American public, to get across, again, why it's so important to reform health care now, to tell that story in ways that the public can relate to after all that's happened over the past month. Second audience is Congress, finding a coalition, either of Democrats alone or a bipartisan coalition, to get legislation passed this year.
But that coalition, that group of lawmakers in Congress, they're going to be talking about trying to convince him to consider a scaled-down version. I mean, we know this White House has already indicated he's going to have to abandon some aspects of his plan.
He is going to have to modify some aspects, but depending on what strategy they want to pursue for getting that legislation through, what you modify may be different. If the focus is on just getting enough Democrats to pass a bill, 51 senators and 218 representatives, that's a very different strategy than if you're trying to aim for a bipartisan bill where you scale back in order to get some Republicans on board.
All right, let's talk about trying to get some Republicans on board. If this president wants to start with a compromise that everyone can agree on, tick off for me the three things, maybe more, you think that they could form the basis of that.
Peter, everyone has talked about a basis for consensus being reforming health insurance so that people can get coverage, meaning no pre-existing condition restrictions, meaning that if you want to sign up for coverage, the insurance company has to issue it to you. It's something Americans are very frustrated and concerned about today. The challenge is that it's very hard to do just that piece alone. If you're going to make insurance companies take all comers, you also need to try to get just about everyone into health insurance. Otherwise, people are just going to sign up for coverage when they're sick, and that's going to lead to higher costs of insurance and lower rates of coverage. We've seen that in states that have tried to do just these insurance market reforms alone. That means you've got to add in new subsidies to make coverage affordable so that you can get everyone in. And if you're going to add in new subsidies, that's hundreds of billions of dollars that you got to find a way to pay for. And coming to agreement on those sources of funding has been very difficult. So you're back into a pretty complicated game.
So there is no health care light that forms a starting point, really?
A health care light bill would not aim for coverage for everyone. Perhaps it could aim for coverage for children. Perhaps it could aim for some more modest reforms around the corners, around the edges in insurance markets, maybe people who are between jobs, children, something like that. That is not the goal of universal coverage that President Obama has talked about so far. From talking to the White House, I'm not sure that they're really ready to go back from that goal quite yet.
All right, what about a public option? Seems pretty clear that this White House is sending signals the president's prepared to walk away from a public option, or perhaps a middle ground here, something he's talking with Senator Snowe about reportedly, a public option that would be triggered if health care prices didn't drop by a certain percentage, if a certain percentage of Americans in each individual state didn't get covered.
Peter, good signal of where the White House may be headed on trying to build this coalition to pass legislation. If the president comes out for something like what Senator Snowe has talked about, delaying the public option for 5 years, using it as something like a fallback, that's a strategy that's aimed to get some Republicans on board. If, on the other hand, he doesn't move back from supporting the public option, something that's been very important to the Democratic base, that's a sign that they're aiming for the Democratic-only strategy.
All right, Dr. McClellan, I'm going to ask you to sit tight. More with Dr. McClellan. We're going to talk about tort reform and as a potential bargaining chip. Betty?
Okay, thank you so much, Peter.